USMLE questions are so ambiguous, how do I choose the right answer? Well, I'm glad you asked. Welcome back to my series, You, Me, and the USMLE, where I share my tips and tricks that help me pass step 1 on the first go and score a 269 on step 2. Key to answering these questions on steps is to remember a few things. 1, do not assume anything. For instance, if there's no explicit statement about sexual history or IV drug use, then the answers that relate to those things are probably not the right one. Second biggest thing is knowing that they have to give you just enough information where there is only one right answer. Let's go through an example together. All right, I'm gonna have you pause to read. For each diagnosis, I create a list in my mind, all the pieces of information that support that diagnosis. Also a list of the things they would have to give me in order for me to distinguish one answer from the other. So this is what I basically do in my brain. Well, the only thing that supports Rocky Mountain in this question is the fact that there's a rash. But for me to definitively know that that's the right answer, they would have to give me more. There's no mention of the specific pattern in which Rocky Mountain spreads. No GI symptoms. Symptoms usually take 3 to 12 days. This is way more acute. There's no mention of a tick. Wheezing is not characteristic. Same thing with toxic shock. Sure, there's rash, there's hypotension, but in order for me to definitively pick that as the correct answer, you'd have to mention things like desquamation or some kind of classic history. And also wheezing is not typical. As we can see, anaphylaxis lines up perfectly. Just keep in mind they're not trying to trick you. Give this method a go for a couple questions, see if it works well for you.